AGC 2025.
Hi, good morning. Right. So at Bangalore, we do a lot of AI application in healthcare, and a lot of innovation in AI is actually done through healthcare. So that's basically what I'm going to talk about. So this is a talk by Sundar Pichai, but then the audio is not picked up by the system, so I'll skip that. But I'm going to talk about 3 different applications, right? And these are all not just health application, but it also has a lot of social implications, right? So I'm going to talk about success of IVF pregnancy. Can you predict? And next is neonatal sepsis, and the third one is predicting inpatient cardiac arrest, right? So if you look at infertility, right? The market is almost about $20 billion, right? The global market, and it is expected to reach about $50 billion in less than 10 years. And if you look at India, India is one of the, if you take the global infertility, 25% is from India, right? And currently it is about 884, maybe more than that, because this is 2022 data. And it is expected to reach close to $5 billion by 2032. Okay? All over the world, 17.5% of the population is kind of struggles with infertility or affected by infertility. And India, it is slightly more. It is about 18.7%. So that's why you see a lot of IVF clinics in India. Okay? And as I said, 25% of the global infertility is actually from India, right? Now, what are the social implications? There are a lot of studies which basically says, at least from an Indian context, 20 to 30% of the divorces are caused because of infertility, right? And couples who do not have child are 3 times more likely to get divorced than couples with child. Right? So when somebody has child, it is not that easy to get divorced because keeping the future of the child in mind and so on. What are the causes? Lifestyle mostly, but also there are a lot of medicinal reasons why people become infertile. I'll not get into many of these aspects, these are all medical terms, but mostly things like hormonal imbalances and so on. And in case of male, it's lower sperm count, etc. Right? Okay, so one of the important things one needs to understand is that, at least in Indian society, that they basically typically attribute infertility to female, but that's not true, right? Both male and female contribute equally towards infertility, right? There are many reasons: late marriage, and the lifestyle, as I mentioned. And at least in India, infertility is perceived as a women's problem, right? Even though, as I said, men and women equally contribute towards infertility, or there's equal reasons why a couple are not able to have child and so on, right? Okay, so the question is, how do we deal with this? One way of dealing with is through IVF procedure, right? And IVF is not an easy decision because when couple can't have children, there are a lot of social pressure, obviously, and there are also a lot of pressure within the family and so on. So even going to IVF itself, sometimes they see a lot of obstacle, and that there's a lot of emotional distress and decisions that they have to take. But the problem is, how successful is IVF itself, right? And I had this slide. As the age increases, the success rate of IVF also goes down. For example, if somebody is over 40, we are talking about like 10 to 15% at max. That's the IVF success, right? So if you go to any IVF clinics, there is usually a counselor, right? And because it's not as simple as you inject sperm on egg and so on, because there are a lot of other decisions that the couple have to decide.
AGC 2025.